You're older now, and most of your active life is behind you. You have time to do a lot of reading. You have just read an article about insane people in mental hospitals and have stopped to reflect upon your own life. You consider how fortunate you have been to have remained mentally healthy. But what about those less fortunate? You find yourself wondering what it would be like to be a patient in a mental hospital.
My name's Ray Stewart. I've found that lots of people wonder what it's like to be in a mental hospital. There are people who know what it's like, and there are people who think they know. Well, I decided to see for myself. There are 4 state mental hospitals in Iowa, and I have visited all of them. Let's look first at Clarinda. This mental hospital, Mental Health Institute, is located in Page County near the southwestern corner of Iowa. The first patient was admitted in 1888, and this institution now houses more than 1,400 mental patients from the neighboring 24 counties in southwestern Iowa. If you think that mental health doesn't directly affect you, let me read you a few statistics taken from The Shame of the State, a book published in 1948 by Harcourt Brace and Company. 1 out of every 17 Americans is destined to spend some part of his or her life as a patient in a state mental hospital. 1 million children, now in elementary schools of the nation, are destined to spend some time in state mental hospitals in later life. Or, it is estimated that for every patient now in a mental hospital, there is another one outside sick enough to require care and treatment in a psychiatric institution. We've read a lot about these places, and from the Woman's Home Companion in April, we find the statement that we have talked of state mental hospitals and called them snake pits. But the real snake pit is not a public institution, it is a public attitude. Dr. Norman Render is the superintendent of the Clarinda Mental Health Institute. Dr. Render, I have heard a lot of things and read these expose types of stories and so forth, and I have been wondering what has happened to the old bedlam and insane asylum sort of thing that people have come to expect, and which, frankly, I didn't find in your institution.
I'm glad to hear you say that, Mr. Stewart. The bedlam type of care in the state mental hospital disappears when the patient is treated as an individual needing medical care, not simply as a monstrosity to be put away or punishment or to be forgotten and better done away with. When we realize that mental illness is curable, and we realize that doctors and nurses and skilled technicians and ward health tend to produce recoveries in mental patients, then we get away from bedlam.
I see. Well, this idea that you're expressing is something that has been in practice only a few years, isn't it?
It has been practiced off and on. I will say that the ancients in the Aesculapian times had something of the same idea, with the old masters' rest and good physical hygiene, sedative treatments, and soothing talks with the disturbed patients. He had something of medical treatment available for them then, although he didn't advance an essay so far as we are now. Then In the interim, there seemed to be a blotting out of scientific knowledge in all fields, including medicine, and the mental illness was considered a kind of visitation by evil spirits, or as a punishment that the patient deserved for sin.
Then things have been one way and then changed to another. To answer the question further of what it is like to be in a mental hospital, I might tell you that it's a matter of the point of view. If you're just a casual visitor to a mental hospital, you might see something like patients working on the lawns or sitting around with the nurses and so forth. This sort of thing a casual viewer would find in a mental hospital. Baseball. If you were interested in volunteer work, as many people are in these hospitals, you would see patients who were gathered around and eagerly interested in what you were doing, and you would say, this is a mental hospital. If you were interested in recreation and in helping the patients to spend their free time, then you would say that patient playing, perhaps, is a mental hospital. There are people who do other things for the patients, such as showing movies, and this is a vital part of their life. In the ward, something is always done to keep them busy. As a dietitian, you would say it's a lot of mouths to feed, because there are 5,100 meals per day at Clarinda. These are the obvious things. But what about the other? We must probe deeper. Well, Clarinda has an outpatient department. People can come in to the screening center to be examined, or sometimes they are committed. The doctor asks questions and tries to find out what their difficulties are. There are many questions to be asked, many things to be found out, and a trained psychiatrist knows how to get out the information and find the deep-lying meanings of the trouble. The social worker has many things to do, and he records everything about the background of the family. Then, of course, after the background and the probings, then the psychologist must take over and perform many, many tests to really discover what causes this person's disturbances, to try to classify the thing, to help the staff in later meetings to know just what can be done for the patient. They want to know lots of things about you, and they want to do things for you. And after they've gathered all of this information, they set you out to a group. Now, for instance, if you were having trouble and became an alcoholic, they might put you in an Alcoholics Anonymous group. One thing that our mental hospitals do, in addition to taking mentally disturbed patients, is to also take volunteer and committed alcoholics to try to straighten them out in that respect. Here Dr. Wolf is talking with an alcoholics group. Then you might be put into what is known as group therapy. Group therapy is actually a sort of elaborate bull session where everyone gets together and talks about their problems with each other and try to help understand each other and thereby themselves. Of course, we go further than that, and what you're seeing now is what is known as electroconvulsive therapy. Electricity is induced to the temples of the person, and a convulsion or a coma is created, and this is extremely helpful. Shock therapy was developed not on the basis of theoretical events, but upon basis of treatment that were found definitely to work. Another type of shock treatment is insulin, and here we see the doctor injecting insulin into the vein of the patient to induce a coma. The patient sleeps. They are maintained in this state for about 2 hours under the very careful supervision of the administering doctor, in this case, Dr. Kaplan. The nature of the mechanisms by which insulin and electroshock therapy bring out improvement are as yet uncertain. There is increasing evidence that shock treatment alone will not be sufficient to enable a psychotic individual to make a satisfactory adjustment to reality. Some type of psychotherapy must follow up on this. But the fact remains that shock treatment has hastened the recovery of thousands of disordered minds which 25 years ago would have been pronounced incurable. The patient is brought out by the injection of sugar into their veins. They're given orange juice and some syrup. Well, that is the more severe, shall we say, types of therapy and treatment which are given. But as I said, these things have to be backed up by other types of therapy. And of course, these people must be kept busy too. And so there's the occupational therapy department, the music therapy department, and so forth. Here we see a patient working with finger painting and doing linoleum block printing. These things are not purely diversional, but are something that are deliberately designed to help the patient. There's reading. They can take these books back to their ward. This girl is a patient who is the editor of the Clarinda Clarion, does much artwork and much writing for the paper. It's helpful to her. If you were in this hospital, you would see lots of volunteer workers, and you would find and you would get the feeling that people are interested in you and your welfare is at heart. There is a chaplain who comes to the hospital twice a week, gets the names of various patients who should have his attention, and goes and visits them. This is a little more of the personal attention which is available at Clarinda Mental Hospital. And of course, there's always the social service director who is ready and willing to help in any way with financial matters, personal matters. He's sort of a Red Cross, all-in-one man in this case, to all of the people who might need his help. Well, we come back again to the question of what is it like to be in a mental hospital. And I would say, again, it depends upon your point of view. But a good way to find out is to talk with an ex-patient. Here with me now is Milton Sanderson of Waterloo, who was a patient at Independence Mental Hospital. Milton, how long ago were you there?
Well, it's about a year and 9 months ago. I was out on leave.
You've been out almost a year, well, almost 2 years.
Almost 2 years, that's right.
I think people would be interested, Milton, in knowing how you came to find yourself, or maybe we better start back and ask you what your trouble was in the first place.
Well, my trouble was started out as really just a family way. It's more or less my interpretation of it. From a denomination. It was what's called a smothering affection, which developed in what is classified, generally speaking, as manic depressive. Mm-hmm. However, there's several fringe symptoms that go around that. Besides.
What was the immediate thing that caused to your being committed to the hospital?
Well, chiefly it was drinking. It started as about at the head.
You had become a community problem, had you?
That's right. I caused considerable disturbance in the community.
How did you feel about being sent to a mental hospital?
I was very rebellious and hostile about it. In fact, the first time I spoke to a psychologist there in the hospital, she asked me what I thought of it, and I said I thought it was an Avon County jail.
Well, were you always aware, I mean, you knew everything that happened in the hospital. You weren't out of your mind, so to speak, at any time?
Generally speaking, I knew about everything that went on. I can recall pretty well.
And you felt that you were railroaded into this thing, did you?
Definitely, when I first went in.
How do you feel about it now, as you look back?
Well, it's like any hospitalization. It was unfortunate, but I feel like I'm richer for the experience and probably will be a stronger person for it.
What in the hospital was responsible for your snapping out of this manic depressive state?
Well, the chief thing, I think, was the group therapy and the physiotherapy sessions with the chaplain, pastoral psychiatrist, Reverend Walter P. Bell, and my physiotherapy after we leave the hospital, Dr. Lee.
I see. Now, on this group therapy, how did it work with you? How did it help you to come out of your state?
Well, it was a matter of discussing common symptoms and common subjects and facts on mental health and illness with Reverend Bell, and an open discussion among the patients where we exchanged ideas. One would give his ideas on how to overcome a certain problem to another patient, and in turn, when something came up he felt particularly strong in or felt he knew something about, he would contribute. And through this exchange of information, we both all gained insight that we were ill and what caused our illness, and some idea of how to overcome it.
In other words, you realized through this group therapy what your difficulty was, and then you brought yourself out of it, were able to control these disturbing influences and symptoms. That's the way that it works. Well, thank you very much, Milton, for your willingness to come here and talk about it, and I think you have helped the people to understand just a little bit more what it is like to be a mental patient. Milton is from the Independence Mental Health Institute. This institute is located in Buchanan County in the northeastern section of Iowa. The first patient was admitted here in 1873, and the institution now houses 1,500 patients. This is an overcrowded condition here, as in most of the mental hospitals in the state. An overcrowded condition of something like 13 to 15%. You'll notice how closely the beds are crowded together. There are 4 beds in the middle of the floor, and the beds around the outside were so close that you could hardly walk between them. Even on the porches, there were crowded conditions. However, there are building plans in the works. The name of this building, incidentally, is Sunny Villa. The building plans will help to alleviate this circumstance somewhat. These are volunteer workers who have come to a ward to put on a party. And the music that is being played for them here is the people who are doing the singing and playing we have brought to the studio tonight, and you will hear them somewhat later. Mr. Ted Flatten, who is at the accordion there, is the music therapist and has brought the group here tonight. Here again we'll get into occupational therapy, and as I told you before, these are directed activities, something which will help the person hold the ground which he has gained. It is not purely a diversional activity, but under the expert guidance of a registered occupational therapist, these things can be extremely helpful in their own right. Another very interesting therapy that is used at Independence is art therapy. Here the patient is able to put on paper the things that he or she feels within themselves, and sometimes these people do not even talk. Now here the man wanted a model. From the girl he drew the caveman, which might give you an idea of how from the pictures they are able to get some insight into the difficulties of the person. There are other therapies which are used here, and at Independence they use what is known as hydrotherapy. In the hydrotherapy department they have steam baths. These have the usual either stimulating or sedative effects of others. This is a needle shower and spray and so forth. It not only gives the stimulation or the sedative effect, depending upon the type, whether it's wet packs, tubs, jets, or whatnot, but it also gives the patient a feeling that something is being done for him, that he's not just left to sit in a ward and think of his troubles. A very interesting, somewhat new therapy that is going on at Independence is psychodrama. In this case, it is unrehearsed drama where the person is put into a certain problem and is, according to his feeling, he goes into the conversation and the action of a situation and tries to explore it or reveal his feeling to someone else by that fashion. Now, this isn't something that is allowed to go on without any direction, but Mrs. Rujar, who has recently come to Independence to set up this program, talks with them afterwards, points out the things that they have done. In this case, she asks them to switch their roles. She said, all right, you were having an argument. Let the wife take the husband's position, the husband take the wife's position. Now go back into your action and see if you can appreciate any more the other person's point of view. You can see from that while a lot of these people's difficulties were emotional, they are in this way able to have some added appreciation of the other fellow's point of view, and therein it becomes a therapy. Perhaps only an interest therapy, but that is the direction it takes. volunteers are now admitted, voluntary patients are now admitted to the mental hospitals. And we have some, at Independence, we have a lounge, as which you see here, very nice place where either voluntary patients or new patients which are coming through a screening center are able to relax between their treatments of various therapies. They have nice home-like surroundings. It's cheerful. This is not true of the entire hospital, but it is true in the screening center portion and in the voluntary patient portions. They have very nice, sometimes private rooms and sometimes ward rooms, but this is a typical room for the voluntary patients. These patients are charged for their care as far as they're willing to pay. Another thing which they have at Independence is the treating of affiliate nurses. It seems that now it is necessary for nurses who, before they can become registered nurses, to have 3 months training in a mental hospital. This training for Iowa is centered at Independence. These nurses get good psychiatric training there so that they can go out and have more of an appreciation of how these people should be cared for. I would like you now to meet Dr. Whitty, who is the superintendent of the Mental Health Institute at Independence. Dr. Whitty, what are you able to do for your patients?
Well, in the first place, as soon as they come in, we start trying to get them to realize that they're not sent there as a criminal, but that they are sent there because they have a mental illness, that mental illness is no disgrace, and that if they will try, we will help them to get well. The first thing we want them to do is to realize that their emotions may have been out of hand, or that their mind may have been playing them tricks.
You say that mental illness is no disgrace. What are your reasons for that?
Because they are just as sick as anybody with a physical illness. They're just as sick, except they're sick in their emotions. And the idea of a disgrace comes back from the Middle Ages when we thought they were beset with demons. And we know better now, but there's still that emotional attachment to it, and that's the first thing we get to get the patient over. So if they won't feel that they've been disgraced and lost all their friends, but coming to the hospital.
Is mental illness hereditary?
No, you used to think so, but now we think that the trouble is if a person has a mother may get upset, well, that may be disturb the emotional life of the child. The child will be having more tendency to break when they get up. It's got nothing to do with the genes or the chromosomes and the germ cells.
Well, I'm interested in knowing what you attribute the change between the way that mental patients used to be treated even 10 years ago and the way they're treated now.
The change came on because we suddenly started. We'd see that these people were human beings and we treat them as human beings. And that we could give them a little more responsibility. And that we would make more efforts to explain to them the cause of the mental illness, which we know more about now than we used to. And then, of course, we have our electric shock and our electric treatment roller and our coma implant and some brain surgery, those things which are the cases we can help with psychotherapy.
I had heard all of these stories about wild people and so forth, and yet at all four of the mental institutions, I made a particular point of going into the disturbed wards, and what I found there was men or women, as the case might be, sitting around reading newspapers, magazines, listening to the radio, yet they were told to disturb the ward. What quiets this thing like that?
That's the ward we call a maximum security ward now, and it is due because of that first place we took the restraints, except for a few wristlets. And during our old attendance for years, nothing happened. Matter of fact, the patients get along much more peacefully than they used to. There is another thing that, of course, electroconvulsive therapy again has helped us in that.
Mm-hmm. That has been somewhat of a sedative for you in that respect. Well, I wish we had more time to go into this thing more fully. You can realize that this is a bigger thing than you can cover in a half hour. Next week we will go on these therapies. We will take you into some forms of brain surgery and some other types of therapy. Actually, these programs are a unit of 2 each. We cannot be all-inclusive. Each institution has more or less the same thing. A few of them has some individual matters. But I feel that by the end of the second program, which is the end of next week, you should be able to get a little better picture of just how our patients are cared for. So be sure to watch next week for the second unit of our story of the Mental Health Institute. As I told you before, we have some patients here tonight who would like to play for you and sing.
The worst sin towards our fellow creatures is not to hate them, but to be indifferent to them. That's the essence of inhumanity. This has been a public service feature produced in the studios of WOI-TV Ames, Iowa by Ray Stewart. The program was directed by Lamar Smith. Script for In Our Care is prepared by Hazel Allen, with production research by Fern Bonamy.